Good morning.
Good morning.
Usually we're used to saying good evening or good day. So good morning everyone, and I welcome all of you, and I really appreciate that every one of you on a Saturday morning came here like at exactly 11 o'clock. So we are still waiting for some friends, and but the ones who are already here, we welcome you all. My name is Temina Naveed. I'm the Secretary of PAK Pioneers Community Organization, and we've been working for the past 4 or 5 years for the community, for the seniors, for youth, and recently, around 3 years ago, we established a center, and we have a lot of here the members who have joined us today. They all come regularly on every Tuesday at the club. And at the club, we provide them with different information sessions, different educational sessions on health and financial issues and legal are faced by the seniors. The reason for us to establish this organization was a lot of inspiration that we got from many of our members in our community who were going through isolation, and they wanted to have somebody, to older adult, you really want someone to communicate with you. Someone who can understand what you are feeling, what you are saying, or who is on the same page when you are sharing some experience or any ideas with them. So for the past 3 years, we have very successfully been running this club at Burnham Cup Community Center, where the city councillor, Ward 3 councillor Chris Fonseca helped us getting a free space for the club, and we establishing a seniors community center in Mississauga, especially for the South Asians, where they can get together, where they can have their people of their own origin, or where they can have people with whom they can communicate in their own languages, and with where they can have people who can share their ideas at being at the same, having the same cultural background. And I would like to welcome our president, Mr. Dr. Masoom Shah. He's been a source of great inspiration for us. He's been a guide for us, and he's always been there to stand by us to guide us through all the works.
Respected guests, ladies and gentlemen, Assalamu alaikum, Namaste, Namaskar, and Sat Sri Akal. And still good morning. This is the problem, if you are saying to somebody at around 5 minutes before 12 that you are saying good morning, his watch might be at 12 and he would say it's good afternoon. But Sat Sri Akal, Assalamu alaikum, and Namaste can be said any time of the day, no problem. Anyway, that's the cultural thing. On behalf of PAK Pioneers Community Organization of Canada, I would like to welcome I don't know if the honorable speakers are here. Yeah, only one speaker is here at the moment. We will have the other two coming soon. I want to welcome them. The title of the seminar today is Maintaining Physical and Mental Health. Physical and mental health as we age. We also welcome members of Senior Tamil Society of Peel, Mr. Arun and his team, members of Senior Sahara Services, and members of Mississauga Seniors Club for joining us in this event. Now I want to introduce PAK Pioneers Community Organization of Canada, what it is. Like Sister Tamina, who is secretary of this organization, she said that we started like 4 or 5 years ago in 2011. We registered our organization with the government as non-profit organization. And since then, we have been working for the seniors. Our purpose of working with seniors is to bring out seniors from home who are sitting at home idle, they are doing either flipping channels or reading newspapers. They can't do it all day long. So we decided to bring them together at one place, and for that we were struggling to get some place to have a club where they can come at least once a week. So every Tuesday we meet at Burnham Thorpe Community Center, which is one traffic light east of Dixie and Burnham Thorpe intersection. So anybody who is 50 and above is considered senior. In South Asian community, I won't say that 67 is the retirement age. I would say it's 50 the retirement age. Because after 50, we are living at bonus. We don't know when we are going. And the reason that our food and our habits, our exercise habits, they are the one causing this. In our Tuesday meetings, we have computer classes starting from 11:30 to 12:30. We teach seniors computer classes, and we have volunteers who teach one-to-one to all the seniors who don't even know how to operate computer. We want to make them learn how to have an email account, how to have a Facebook account, how to surf the net. One of the very educated person who is a regular member of our club, when I asked him, why don't you have an email? He said, I have a Gmail. I don't have an email. So I said that sometimes that also doesn't interact or communicate. So you have to change your habit. You have to get a computer and learn computer. So now he has started learning. Hopefully he has an account, and now he will be doing surfing and communicating with people. So it's a way of getting in touch with other people. So this is the other thing that we are doing. In our senior club, we have like 12:30 to 3:30 time every Tuesday. The first part is for information sessions. Since April 2013, we have organized several information sessions, mostly on health issues for seniors. And they have, they are all valuable lessons that they learn from those sessions. Recently, we have organized a health session on cardiovascular health. It was a workshop, and it was a very successful workshop. I think almost 150 people came and attended that, and they said that it was very good. And just recently, we had an information session last Tuesday on bladder health, and people liked it. It was very valuable. There was very valuable information in there. And this next Tuesday, we are going to have a senior's eye health issue, which is called cataract. We will be talking about that. We will be giving information session on cataract. So I want anybody who is 50 and above, you are welcome to come and join this PAK Pioneer Senior Club so that you can learn over there. This is not only learning. I mean, the first session, which is about an hour session over there, is for information session, and the rest is just like having fun, because we have a break where we offer refreshments, and after refreshments we have a social time where people interact with each other. They also share their talents. They sing songs. They exchange jokes. Whatever they can do. There are hidden talents in our seniors. Some seniors are very good singers, so we enjoy their singing too. So I would ask you, if you have a hidden talent, come over and join us, and we would love to have you. I think I have to wait till the next. The other presenters will come here, the information session presenters, the speakers of the day. Yeah, we have Dr. Rashda. Having said that, I would like to say that seniors who are sitting alone at home, flipping channels or reading newspaper when they get tired, they have nothing to do. The loneliness brings, kind of depression to them. And depression is the biggest disease, which brings up different diseases to them. So it's good that they once in a week they come and join the club and enjoy there, have a quality time. They will always enjoy there because all things are every day. Every Tuesday we have different functions, different things. Every Tuesday of the month, last Tuesday of the month, we have lunch arranged for them, and they enjoy there. The only thing is that they have to come out of their homes and reach there. That's the important part. So, well, we have one speaker available here. I would ask her to come, and Dr. Rashta Shoaib. She's here, and she would like to come, and I would ask her to come and sit on one of the chairs here on the stage. The other speakers will come and join her. So, Dr. Rashta, please. Yeah, have a seat. Dr. Rashta is Manager Health Partnership with Canadian Association of Multicultural People. Dr. Rashta has been very kind to us. She has been frequently visiting, has been frequently invited to our Tuesday meetings to offer information sessions on health issues related to seniors. We feel like she is part of us. Her topic of the day today will be importance of cancer screening. That's better. So, Sister Tamina, should we ask Dr. Rashta to start? Okay. Okay, let them fix that. So we want to thank Dr. Rashta for doing that services that she's offering us. Can I have her a big round of applause, please? Thank you. Yes, Dr. Rashta.
So as the first speaker, Dr. Rashta will be, doing her information on the cancer screening, importance of cancer screening as we age. Then we will have Dr. Muhammad Amin. He's a psychiatric, professor of psychiatry at Toronto University. He'll be joining us soon. And because it's raining outside, so, things are getting a little behind. And then we will have Dr. Mumtaz Hassan. He's the ex-Vice Chancellor of King Edward Medical University, Lahore, Pakistan. He will also be here. And Dr. Amin will be talking about the mental health issues as we age, and Dr. Mumtaz Hassan will be talking about the heart-related issues that one suffers or faces as they get older or as they age. So, and after that, we'll have lunch and a question-answer session. You all can see on your tables we have some ballpoints and some cue cards, or like those small cards. We would appreciate that while when the speaker is talking and you have a question, you can just write down the question on the paper, keep it with you. The volunteers will come to you, and then they will collect the cue cards from you with the questions on them. And then at the end, whomever you want to ask the question, just write the name of the speaker so that we can give them the cards, and they can answer you the questions, answer your questions at the end of the session. So thank you very much. And one more thing that we all would appreciate, everybody, if you can, quietly and with complete silence, if you can listen to the speaker without, discussing among each other of you. Thank you very much.
Good afternoon, everyone. I won't waste time introducing myself because Tahmina has already introduced me quite well. So today I'm going to talk about the importance of cancer screening as we age. The studies have showed that after the age of 50, the risk of cancer, it increases. And the reasons are many reasons, but I won't go into detail because my focus today is to guide you guys to know about the importance of cancer screening. The word screening, I think most people are not familiar with it because they think if someone has cancer, he has to go for cancer screening, but that's not correct. Cancer screening is basically for people who are healthy and who don't have any symptoms of cancer. It's basically for healthy adults, I would say seniors, because above the age of 50, we are talking about people who are above the age of 50. So what people have noticed here that in South Asians, the screening rate is really low. People don't go for screening, and they don't have information that cancer screening is important after a certain age. There were lots of studies done by Cancer Care Ontario, and I was part of one of them. And there we learned about the barriers which are there for the South Asian community to go for cancer screening. And Cancer Care Ontario basically picked up 3 cancers which they thought were important as they are easy to screen, and they have noticed that the advantages of screening them is more than the disadvantages. And those cancers were colorectal cancer, breast cancer, and cervical cancer. So I'm going to touch like all 3 of them one by one. And if you guys have any questions, you can just write them on the cue cards you have, and then I would love to answer them at the end of the session. So first, I would like to talk about colorectal cancer. Colorectal cancer is one of the leading causes of death in seniors because it is quite common, especially in South Asian communities. Colorectal cancer is basically the cancer of the last part of your intestine. The last part of intestine is called colon, and the last part of colon is called rectum. So you should have an idea that where your colon is in your body. People may ask that why am I at a risk of having colon cancer? And I think you should be knowing a little bit about that, because if you have a family history of colon cancer, you are at a great risk. And being 50 and over is another great risk of having a colon cancer. So everybody over the age of 50, Cancer Care Ontario, they tell you to get tested for colon cancer. And that's a very simple test. Your family doctor will advise you. That's called the fecal occult blood test, a stool test every 2 years if you are above the age of 50. And this will help you get screened against colon cancer. And if you are at a higher risk of colon cancer, for example, you have a family member who has colon cancer, you can start early, but you have to talk to your family doctor, and they will advise you what to do. And if the fecal occult blood test comes positive, then they will guide you to have some more tests like colonoscopy, sigmoidoscopy, but that's not for everyone. So everyone above the age of 50 should have this simple test done every 2 years. That's recommended by the Cancer Care Ontario. And my main concern is to let you guys know that it's not, because people get scared of the word screening because they think if they get screened, they might get to know that they have cancer. And that's the main barrier which prevents them to go to the doctors and get this test done. But trust me, if you catch cancer at this stage, it is very, very, very curable. More than 90% of cases are curable, and you will get rid of it. So it's a good idea to get screened and don't ignore your health. And I'll just quickly go through the risk reduction and the early detection of that colon cancer. So there are a few steps which you can do every day to help yourself reduce the risk of cancer, colon cancer. Number 1 is be physically active for at least 30 minutes, at least 5 days a week, and maintain a healthy weight, because we have noticed that people who are overweight have a more risk of colon cancer. Don't smoke, because smoking is another risk factor. And if you drink alcohol, no more than 1 drink a day if you're a woman, and 2 drinks a day if you're a man. So you have to limit your alcohol intake too. eat fruits and vegetables and whole grains to stay healthy, and cut down on red meat and processed meat, because studies have linked both of these items to the increased risk of colon cancer. Now I would switch to the other cancer, which is the breast cancer, because I see quite a few female population too. Breast cancer is also the cancer which is very common amongst the females, and I would like you to know that breast cancer, if it's caught early, 90% of the women will be recovering fully from the treatment, and it's less likely to spread, and you have more options to treat that cancer. So breast cancer screening is the best possible way to get yourself detected early and get best treatment. So Cancer Care Ontario suggests that every woman over the age of 50 should be screened every 2 years. That's for the healthy females who don't have any family history or any risk factors of that disease. And the main test they do is called a mammogram. I think you are familiar with that word. Some of you might have heard about this. It is kind of an X-ray which X-rays your breast tissue to find out if you have any kind of a tumor or a lump. And the mammogram can pick lumps before they start. Before you can even feel them, the mammogram will pick up that lump, so you can be diagnosed like very early, before the symptoms start or before you feel something in your breast. So all the women aged 50 to 74, it is recommended by Cancer Care Ontario that you should be screened every 2 years. You should be having a mammogram. And if you have high risk, by high risk I mean if you have a family member like your mother or sister who has breast cancer, then this means you have increased risk of breast cancer. So you should be screened early. So talk to your doctor between the age of 30 and 69. If you are at high risk, you should be screened early, the other population, which is 50. And just want to let you know that there's no charge for doing that mammogram, and it is covered by OHIP. And if a doctor recommends you, you can do it. And there are other, and there are lots of breast cancer screening program clinics going on, and you can just call them, and I can provide you that number. If you want to get screened, they will help you get screened. And now I would like to talk some tips about reducing the risk of breast cancer. Mainly reducing risk is to maintain a healthy body weight. Stay active, reduce your alcohol intake, don't smoke, and limit your time on hormone replacement therapy, because people have noticed that females who were getting the hormone replacement therapy around menopause were at more risk of getting the breast cancer. So you should discuss this with your doctor if you are taking that therapy. And you should always discuss changes in your breast. You should be doing a self-examination every month. And if you feel something is different or weird, you should always talk to your family doctor. Now I will talk about the cervical cancer. Cervical cancer is most of the people, they don't know the details about that cervical cancer, and they think, especially I've noticed South Asian communities, they don't think that they need to get screened for cervical cancer. But that's not true, because cervical cancer is quite common, and it is quite common in females of a certain age group. So you should be screening for this cervical cancer, and it is caused by a virus which is called a human papilloma virus. And this is 100% of cases of cervical cancer are caused by this virus. And 3 out of 4 women would get this virus. Not all of them would get cancer, but 3 out of 4 women will have this virus in their bodies. And usually there are no symptoms of this cancer, so it is really deadly if you don't get screened and it gets detected later, so then it'll be too late for that. So Cancer Care Ontario recommends all the women of age 21 to 74 who are sexually active to get this test every 3 years. That's called a PAK test. I think some of the females would have heard this word before. It's called a PAP test. When you go to your family doctor, she just scrapes some cells from your vagina, and then they go to the pathology lab, and then it comes back if it's normal or abnormal. So, so all the females above the age of 21, if they're sexually active or have been active, should go and do this test. And if the test is abnormal, then your doctor will guide you to do some further testing to figure out what's going on. And you don't need a doctor's referral for this. You just go to the cervical screening program. It is run by Cancer Care Ontario. And you can just go there, and they will enroll you in that program, and they will guide you to do the PAP test every 3 years. And there is a vaccine which is provided for the young girls, like grade 8 girls in Ontario. They are provided with this HPV vaccine, which basically gives them prevention against that virus so that they don't get it in the later life. So now tips to reduce your risk of cervical cancer. Go for regular PAP tests. You should be getting regular PAP tests every 3 years. And also consider the immunization. If you want to be safe, you should go for HPV immunization. Always use protection during sex. Maintain a healthy body weight. Don't smoke. Stay active and manage your stress level. Because studies have shown that if you are in stress, your body's immunity gets low, and you're not able to fight the viruses and all the other bacteria in your body. So it's a good idea to manage your stress level. So that's pretty much it for today, and I hope that you guys just get some information for this cervical, breast, and colorectal screening. Yes.
Prostate cancer.
G?
Prostate cancer.
Okay, you know what? I was basically wanted to talk about these three, but prostate cancer is quite common in seniors. But the Cancer Care Ontario, it's not doing the prostate cancer screening on a regular basis. But if you have a high risk of prostate cancer, somebody in your family has it, you should always talk to your doctor, and they will help you get the screening done. But it's not covered under this program, which is running by Cancer Care Ontario. They're only picking up breast, cervical, and colorectal cancer, because these are the cancers which can be screened easily, and there are more advantages of getting screened for these cancers. But for other cancers too, you can talk to your family doctor, and they will guide you to get the screening. But it's a good idea to know your body, and if you feel any changes in your body, always go talk to your doctor and get yourself checked. So thank you so much for your time, and I hope you guys.
Thank you very much. Now I would, we have both the speakers, the rest of the two speakers available. They have arrived. Thank you very much for coming. I would ask Dr. Mumtaz Hassan to come over and have a seat on the stage. Please give them a big round of applause. Dr. Mumtaz Hassan, the government of Pakistan gave him Sitara-e-Imtiaz because of his services and achievements. He is the first Vice Chancellor of King Edward Medical University, and Mumtaz Hassan played a key role in getting King Edward Medical College, Lahore, a university status. So he was the last principal of the King Edward Medical College too, and the first Vice Chancellor of King Edward Medical University. He has been personal physician of the UAE and Pakistani heads of states. Dr. Mumtaz Hassan has conducted a few information sessions on health-related issues for seniors in our Tuesday meetings. We would like to have him quite often in the times to come. And today I want to thank him for coming and participating in this seminar. Now I would request the second speaker, the last speaker, who is Professor Dr. Amin Mohammed, on the stage, please. Please give him a big round of applause. Dr. Amin Mohammed graduated from Dow Medical College, Karachi, Pakistan in 1984. He worked with UNICEF in the project related to health education of women and children in a number of villages of Pakistan. His postgraduate qualifications are FRC Psych, UK, FRCP Ireland, FRCPC Canada, PhD Anglia Ruskin University, UK, board certified in psychiatry, University of London, UK, diplomat in psychological medicine, Ireland, diploma in clinical psychiatry, Ireland, MCPS, Pakistan. He taught psychiatry at various levels in Karachi from 1994 to 2001. His teaching career ranges from teaching lay people in the community to medical students, residents, postgraduate doctors, and allied medical health professionals. To his credit are more than 100 papers, research papers, and 7 books. He came to Canada in September 2004 and worked as consultant physician psychiatrist in New Brunswick. In 2006, he was offered a position of full professor of psychiatry with Memorial University in Newfoundland. He is also an internal examiner for the Royal College of Physicians and Surgeons, Canada. Dr. Amin Mohammed has recently moved to Ontario and is now a faculty member with University of Toronto as full professor. Today, his topic is mental health issues in older adults. So now I would request Dr. Mohammed Amin to come and, is there anything?
Just tell them that he wants to go to his town, Consul General. Or
Is he here?
No, he'll be coming. Or to Zishan, a counselor. Zishan Hamid from
Zishan?
Zishan Hamid.
He's here?
Counselor, yeah.
Okay.
Yeah.
Okay.
So we would request him to stand and say hi.
Well, what's his name? Dr. Asghar Ali Golu, who is the Consul General of Pakistan, Toronto, he will be coming soon, joining us. He is the chief guest of today's meeting. He is very busy, and he will just drop in for some time. And we also have Zishan, the counselor, here available with us, and from Milton. Please stand up. Yes. Thank you for coming, Zishan. Thank you very much. Now I would request Dr. Amin Mohammed to come and deliver his lecture.
He's a wonderfully good speaker. Give him a big hand.
Big hand, please.
Thank you very much. Thank you very much, Professor Mumtaz Hassan, and thank you, organizers, for inviting me. I was thinking a lot as how should I present my talk today. I did it several times using multimedia, transparency is a lot of other things, but I thought that today I'll keep it extempore and interactive. I would like to make it interesting for you, and I can speak a couple of languages, so I don't mind if you ask me a question in Punjabi, Sindhi, Bengali, Gujarati, Hindi, any language. A little bit of Arabic and a little bit of Persian also. So English is okay for now? Should we start with English? Okay. Now, the question is mental health issues. Mental health is always a stigma. People do not want to go to a psychiatrist. And let me start by saying that when I chose to become a psychiatrist, I didn't want to become a psychiatrist. What happened in Pakistan when I was graduating from Dow Medical College, once I expressed my interest that I am going to pursue career in psychiatry, and one of my friends said, "Ye apni zindagi kharab karega." And other person said कि जो psychiatrist होते वो तो डॉक्टर ही नहीं होते. और कुछ लोगों ने कहा जैसे हम कराची के we were working in a central jail in Pakistan looking after children. They used to call it juvenile prison in Pakistan. We did a lot of projects when in Pakistan. Me and my wife who is here, we were very much active in doing this. We went through different villages with UNICEF, WHO, everywhere, and we learned a lot from the people who were at the grassroots level. And some of my colleagues said that if you choose psychiatry, you will not be called a doctor. What is the purpose of doing MBBS and doing MD and all this thing and become a psychiatrist? And in the jails, the juvenile prison, there was a unit which is called Charyong ka ward. Charyong means in Sindhi language, they say for people who are crazy, who are mad, who are insane. So this is how people with psychiatric illnesses were described there. I had a family member visited me and said they are going to file a divorce petition because their new daughter-in-law is not cooking enough. She's not looking after the household. She's all the time crying. She's always sitting in one corner and not doing anything. So I think either there is a genic influence, either she is possessed, or she is under the influence of an evil eye. And this was there was a deceit in that because the parents of that particular lady, they did not tell us that she's crazy. And our poor son entered into a holy matrimony under this impression. When we visited their house, we found that she was severely depressed. We started her on antidepressant medication. She did wonderfully well. And later on, when the mother-in-law came to us and we asked her, how is your daughter-in-law doing? And now she's cooking about 15 chapatis a day. She smiles off and on. So this was their parameter. This is how they expressed that she's improving, but they did not acknowledge that this was depression. Now, coming back to this, mental illness is not in your control. Every family, there'll be one or two people suffering from some mental health issues. Believe me or not, look around yourself. There are friends amongst yours, there are family members, brother, sister, parents. Actually, it is genetically linked. It's a huge, like Dr. Saab was mentioning about the colorectal cancer or those things, but I think there's a huge genetic component. And if your genes are determined to have depression, if your genes are determined to have obsessive compulsive neurosis, schizophrenia, dementia, it is in your gene. Environment is an excuse to trigger that. So we are not immune to mental health issues. And when Dr. Saab was mentioning about the stress levels, any stress can precipitate severe depression, anxiety, obsessive compulsive disorder. Having said this, we also need screening for mental health issues. And I would strongly, and there's no provision by the Ontario, the government that we should screen for depression, we should screen for OCD or screen for dementia, but there's a huge need of that. Our social milieu, our social fabric needs to be looked at. Now, coming back to this, there are a couple of things. I would like to ask you that how many of you, amongst you, did someone ever feel depressed? Even for a day, you felt? Everybody. Is there anybody who was always happy? No depression, no stress, no anxiety? No. Anxiety is something that you feel uneasy in yourself. You feel something is going to happen to you. In a layman term, I'm trying to explain to you. I don't want to make it a medical talk. But if you feel that your heart starts racing, if you feel that you are having some shortness of breath, you feel butterflies in your stomach, you feel uneasy, you feel something is going to happen, you feel that something, I may get a colorectal cancer because my uncle had it, and you keep on thinking about it. Oh, I went to the washroom today, I had a delayed evacuation of the bowel, my dietary habit is changing. Even for one day, you start thinking that I'm suffering from cancer. I think there is a cancer. Let's go to the family doctor and talk. These are all the manifestations of anxiety, shortness of breath, dizziness, tremors, increased frequency of urine, going to washroom again and again, and feeling nervous in yourself. It is just like you are going to attend an exam, or you are going to appear in a viva voce, or you are going to see a big personality in political, or you are facing FBI or someone, and you feel how that particular feeling is anxiety. And if it remains there all the time without any disruption, then you are suffering from an anxiety disorder, and you need treatment for that. If you feel that life is not worth living, you feel like crying, you feel hopeless and helpless, you feel that it's the end of the world, economy is going down, my grandparents died, you think a lot about people who are dead, and you feel like crying, you don't want to do anything. The student will come to you and say that I was about to finish a chapter. I always used to finish a chapter in 2 hours. Now I'm taking the whole day to finish it. I can't concentrate. I can't focus. And then you get suicidal thoughts. First of all, it starts with life not worth living. then you feel, I wish I don't wake up in the morning. Many of you, many of the people around you would have said this, that I wish I could die. Some people would have active suicidal thoughts. They go and jump from the bridge, they tie a noose around their neck, and they would take an overdose of medications. Once upon a time, people used to say that these are coward people who commit suicide. I would say they are very brave people, because it's not easy to give your life just like that. But the problem is the 5-HT2, the neurotransmitter in the brain, 5-HT2, leads you to kill yourself. So how can you prevent that? Because your chemicals, your brain is saying is advising you to kill yourself. So this is called major depressive disorder. And suppose if you start hearing voices in your ears, somebody says, go and shout, go and hit that person, go and shout obscenity, go and write graffiti, go and do some terrorist activity, and you are hearing this from your ear, it's called auditory hallucination. Or you see somebody coming to you. A patient came to me and said that his grandmother comes to him every night, and they spend 2 good hours talking to each other. So he was seeing his late grandmother, and he used to say that I also used to see genies around my home. So visual hallucinations, sometimes you feel that you start tasting something different. That is called this taste hallucination. Olfactory hallucination, you start smelling burning leather. It's a sign of epilepsy also. It's a sign of olfactory hallucination. Sometimes people say that my intestines are being pulled apart. Somebody is pulling, or somebody is possessing me. Somebody is inside my body. It's called delusion of possession. So there are a lot of things, and this is called psychosis. And then there's a criteria to call somebody a schizophrenic. They lose touch with the reality. They stop washing and bathing. They stop taking care of their personal hygiene. They talk to themselves. When you will see them, they're weird. They don't look after their dressing, and they deteriorate progressively. This is schizophrenia, a very serious illness. And now all these symptoms are common for elderly also. So age above 65 is a very crucial age for dementia. Even before that age, it is called pre-senile dementia. So dementia is a condition in which you start having the anxiety first, then your mood goes down, and then you start talking a lot at night. You talk a lot, you talk about past things, you start forgetting the recent events. You forget the names. How many of you are forgetting names these days? Many of you. There's no age bar. Even 20-year-old young boy would come and say, I'm forgetting the names. Don't worry. This is all common. We do forget the names. I'll tell you how to handle this. And this is the aim of my presence here, that I'm going to give you some tips to protect yourself from this disaster, from this volcano of mental illness, which is a dreadful enemy and is superseding the physical illness. So coming back to dementia, you start forgetting the recent events, but you remember 40 years or 50 years back things. He said, once upon a time in India, I was playing outside. And they say, my teacher is right on coming now. And they go into the past. So they think a lot, they remember a lot of past events, but they start forgetting the recent event. And a time comes when they start forgetting the past events also. So their memory their cognition is affected. They talk to themselves. They get symptoms of psychosis. They get symptoms of depression, and then their life expectancy gets shorter. 1 to 5 years survival once you get Alzheimer's or once you get senile dementia. I would say you will survive 5 years unless you try to block that process, try to hold that process. Then nothing will happen. But we all are vulnerable. You must have heard of heart attacks in olden times when people used to get heart attacks at age 70 or 80. Now I've witnessed 30-year-old young men getting heart attacks. What is happening? What is going wrong? So very soon you'll get the memory problems and other things in young age people. What we should do, we'll talk about it in a minute. The other thing is, apart from this, you also get obsessive compulsive disorder, which is very common. 3% of the population suffer from this. 1% suffer from schizophrenia, 15% suffer from major depression, 6% suffer from anxiety disorder, and obsessive compulsive disorder, 3%, some centers say it's more than that. This is a problem which is very common. Some of you are very perfectionist. You want everything in order. 8 o'clock breakfast, 8 o'clock. If it is 5 past 8, you would not like it. Some people are very rigid. Come home at 9 o'clock. If you don't come at 9 o'clock, they get upset. I know a senior professor, a late professor of mine, I set a time with him in Pakistan to go out with him for dinner at 9 p.m. I reached at 10 past 9, and he was so annoyed. No, I don't think it's a good idea to go for dinner now. It's 10 minutes over. These are the persons who are called, they have the OCPD, Obsessive Compulsive Personality Disorder. And these are the people who would be and these are the people who are vulnerable to get OCD. OCD is that you keep on asking questions again and again. You want to get reassured. You check your locks in the house. You clean everything. You wash your hand 10 to 15 times a day. And you just, I can give you a funny example. Treating psychiatric patients for more than 20 years is a challenge. Some people ask me how you are sane. And I said, when I come home, some of my friends would joke that he must be analyzing us. I said, no, you don't have a OHIP card at this moment, so I'm not analyzing you. This is a joke that I create, but the thing is, it's one of my patients in the Republic of Ireland when I was trained, I was a trainee, a patient who always used to ask me, can I go home this weekend? And he was suffering from severe obsessive compulsive disorder. He would every time ask me 15 times in a day. All the treatment was on, he was getting, but he was not getting him better. So one day I said, his name was, I still remember, Fergus was his name. I said, Fergus, can I go home this weekend? He smiled and said, yes, you can go home this weekend. Then I turned around, I came back and said, can I go home this weekend? I did it 10 times. And then he started avoiding me. He stopped asking these questions. It was a rude way of treatment, but I remember that sometimes you have to be firm and you have to go out of the boundaries of guidelines and the boundaries of biological management. So OCD is very common in the young people also. It makes you very slow. There are a number of other illnesses, like all time they say hysteria, all time they used to use different words, psychosomatic disorder, a lot of other things, and there's one thing which is called post-traumatic stress disorder. If you see somebody, you see an explosion or a bomb blast, you're likely to get severe nightmares, recurring nightmares, fear, avoidance of the places, numbness. All those features are post-traumatic stress disorder, and we are all vulnerable to that. The one thing, there are also personalities. There are different types of personalities amongst us, and sometimes we are a combination of different traits in our personality. One is called borderline personality disorder. Amongst your relationships, you start observing other people. Some people are always complaining they are feeling bored, they get depressed, and they get high. Sometimes they will spend a lot of money on you, and sometimes they will curse you. Their mood fluctuates, they cut themselves. All the time they cut, and they repeatedly attempt suicides, but never completes it. And they have explosive anger. These people are called borderline personality disorders. Then there are antisocial or psychopaths. Psychopaths are a person who are involved in all the terrorist activities. They kill the other human being. I remember interviewing a gentleman in Karachi prison, and he said he killed 100 people. So one day I asked him that, did you not get any regret? Were you not remorseful when you were committing this murder? And he said, I enjoy when the people are in pain and in trouble. So these are the typical psychopaths. Then there are some narcissistic people amongst us who love themselves, who look into the mirror and say, wow, what a wonderful person I am. Can anybody be koi hamsa ho to samne aaye? But they don't understand that there are so many people who are hamsa and they can come. And if somebody would come forward, they will get more annoyed and they'll get more upset with that. So there are different types of personalities. Then there's a bipolar mood disorder, which is very common, in which you get highs. When you are high, you are spending a lot of money, you are talking a lot, you are laughing, giggling, you are spending a lot of money, you are making irrational judgment, you are driving the car so fast, you feel that you are Angelina Jolie, or you are Burt Lancaster, or you are the President of the United States. And then they sink into depression and they feel like committing suicide, they don't want to talk, they do not want to get out of the bed, and these people who need mood stabilizers. The common problems, common mental health issues, I can go on and on, but I don't want to bore you. But the question is, how should we prevent ourselves from mental illness? One, don't run after money. Let me tell you, this is the money racing world. If you are contented with whatever you have, you are happy with the simple dress you wear, you are happy with the simple food you eat, and you don't envy other people who are having a lot of money. But just be happy the way you are. Just try to give love and affection to people. Don't think negative about people. Try to help other people, like a Sadka Jariya type of thing. No matter, like Mahatma Gandhi said, that if somebody would slap you, I would offer my second cheek to that person. And our Holy Prophet also said that. And other religions, Jesus said that. And Guru Nanak, Lord Guru Nanak, and Lord Buddha, all those people were the great preachers. And sometimes somebody who tells me that there were 124,000 prophets, correct me if I'm wrong. So where are this 1,24,000 prophets? It could be Lord Buddha, one of them. Lord Rama could be one of them. Anybody could be them. But all of these people, they taught us really good values. One is this. Two, if you start feeling low in your mood, if you feel anxious sometime, talk to your family doctor first. So Dr. Sahib, can they come to you and talk to you? And that is the initial screening, and from there they can be referred to a psychiatrist if needed. Ongoing counseling, like your seniors committee, the organizers, and Chaudhry Sahib is the organizer, and I would request him to organize such sessions among the people here. Let's talk about good things in life. Let's share our miseries and worries. Ventilation is a big thing. A patient came to me and she said her mother-in-law is very strict. She's imported from Pakistan as a bride, and now she is stuck in a basement apartment. No say, nothing she can do. And she's very upset with her mother-in-law, and she was getting very depressed because of that. She cannot ventilate. So I said, why don't you do one thing, madam? There's a Japanese technique. Go to your room, write on a pillow the name of your mother-in-law, and start caning and beating that pillow and cursing and swearing. Nobody will listen to you. You will be you, and the pillow will be your mother-in-law. You will be ventilating everything. So ventilate, talk to people. In Pakistan, they used to say, one on the wall, I wrote, don't commit suicide, talk to us. So if you feel like harming yourself, feel like committing suicide, talk to somebody. Crying. People say that men shouldn't cry. And I would strongly recommend that men should cry. Not cry, but cry loudly, that everybody can hear. Because this is the ventilation. Men bottles up a lot of things and get a lot of problems, both mental and physical. If you are under stress, if you are depressed, you are going to get diabetes mellitus, you are going to get hypertension, you are going to get all the physical illnesses, including cancer. So don't let yourself get upset. Remain in a stress. You cannot avoid stress. You cannot live in a zero stress environment, but try to avoid stress. Do some exercise every day. Go for a walk. Go in groups. Meet with your colleagues of your own age and elderly. Listen to good things. Listen to music. Listen to spiritual things. And do whatever makes you happy in the day. And that is my only submission for today. Thank you.
Thank you very much, Dr. Amin Mohammed. Thank you so much. It was wonderful listening to him. It was very interesting. Do you want to come and say something?
Thank you once again, everyone. So I would especially like to welcome Judge Rafiq Rokriya. He's the citizenship judge with his wife. Thank you, sir, for coming. And we also have with us the MP Peter Fonseca's staff officers, Diane Siggins, Radhika Sriram. We welcome you here, and thank you very much for taking our time to be here. And I would also like to thank and welcome Mr. Alisha from Z9 Media. He's a person who always, makes it possible for us to get all these stuff printed out within hours, like 1 or 2 hours, and everything is ready. And most of all, I would like to thank Mr. Safir Mufti. He's the, he's the person because of whom we get to get all those beautiful photographs. And then, a lot of people get, can see us on the Facebook and on the website. And we have with us Mr. Sabir Gaya. Thank you very much for being here. And he is also assisting and helping Mr. Safir Mufti. And thank you very much for giving us this favor. We have Dr. Khalid Taj. He's, with us today. Thank you very much, sir, for being here. He's involved with the politics here in, from Pakistan. Like he's the president of Pakistan Muslim League Noon Group here in Toronto, GTA, or in Canada. Right. Thank you, sir. And I hope that as the thing goes on, I will be thanking all of you individually. Thank you very much, Mr. Arun, the president of Senior Tamil Society of Peel, for being here with his group. And we also invited the Senior Sahara Services, and their members are also here. Thank you very much for being here. And we have Allama Muhammad Awan Sahab. He's the Imam of Mississauga Muslim Community Center on Dixie Road. And we have the Mr. Jami Mustafa. Yeah, most of the people know him by that reference. So we have the chief editor of Urdu Post, Mr. Tausif Ahmed. Thank you very much. And all those volunteers in the organizing committee, Mr. Jalaluddin, he also was here, and especially Mr. Sarwar Chaudhry. He is, he's the person behind the success of this event, because he won't let anybody come in without paying or without a ticket. So if he's not here, we might end up with a lot of people. Thank you very much, Mr. Sarwar Chaudhry. He's also on the board of directors. And we have with us Mr. Saeed Bari, a renowned political figure in Mississauga. Thank you very much, sir, for coming here and joining us. And that's about it. And I really apologize, but as soon as I keep on, thank you. Well, those of you who know Naveed Chaudhry, you know very well, he's going to make me thank everybody individually. So thank you very much, everyone, please. Because, okay, so I'm getting all those signals from him. Thank you very much, Mr. Sohail Ghayur from Ghayur Accounts, to being here. Thank you very much for joining us. So as soon as I get more instructions from him, I'll be here. Thanks.
Thank you very much. I couldn't do that. That was good. Now, ladies, our last speaker, who is Professor Dr. Mumtaz Hassan Sitara Imtiaz. He taught hundreds of medical students who are working all over the world, most America. So we welcome him with a big round of applause, please. Thank you very much.
Thank you very much, Dr. Masoom Shah, Mr. Naveed Chaudhry, and his better half for organizing this session and inviting me over here. I'll try to be very brief, to the point. We'll try to avoid the medical terms and try to talk in a layman manner. However, it is very difficult to talk when two eloquent speakers have already spoken.